Welcome back, everyone, for another deep dive. Today, we're going to get into acute inflammation of the breast. Um, we see it in a lot of different patients, but, it's really common in lactating women, as we know.
Oh, yeah, for sure. I mean, if you're dealing with postpartum patients, lactational mastitis is pretty common,
Right.
actually. Incidence is what, like 3 to 20% of breastfeeding women?
Yeah, that's a lot of patients, right? And when we're thinking about these patients, usually it's Staphylococcus aureus, right? That's the bug we're worried about.
Yeah, definitely.
Especially in the hospital. Got to think about MRSA, of course. But
Hmm.
what we're going to talk about today is, how do we get from that initial inflammation all the way to forming an abscess?
Yeah, that's the important part.
How does this all happen?
Well, thinking about what causes this whole thing,
Yeah.
it can be bacterial or
All
non-bacterial.
right.
And, I think a lot of times we see the bacteria actually get in through the nipple.
Yeah.
Maybe there's a little crack there or some retraction. But we
Yeah.
can also get a blocked lactiferous duct, right?
Mm.
That can be from epithelial debris,
Yeah.
and that leads to milk stasis, and then, boom, you get the secondary bacterial infection.
Makes sense when you think about the fluid dynamics of it.
Yeah, totally.
So then once that staphylococcus gets in there into the ductal ampulla, that little widened part of the duct, seems like that's where it all starts to go
Well,
downhill.
that's when they really set up shop there.
Mm.
They get in there, and actually the bacteria trigger the milk to clot,
Oh, wow.
and then they multiply like crazy in that clot.
So they're just like living it up in there.
Yeah, they're having a party.
And I feel like we see these abscesses pop up more at certain times during breastfeeding, right?
Yeah, that's right. Like the first month postpartum is a big one.
Oh, for sure.
Often it's because of trouble with the breastfeeding technique itself.
Right.
Like maybe the baby's not latching on well.
Makes sense.
So there's incomplete emptying and engorgement. And then we also see it again when moms are weaning their babies.
Oh,
Probably because of engorgement again. And sometimes the baby's teeth cause trauma to the nipple as they try to, you know, figure out how to eat.
so if a patient comes in, what are we seeing that makes us think, uh-oh, maybe this is what's going on?
Well, a lot of times it starts out looking like cellulitis, redness, warmth, tender to the touch across a certain area of the breast.
Yeah.
The thing we're really worried about is it turning into an abscess, right? If we don't catch it in time.
So if we do think it's turned into an abscess, what are we feeling for when we examine the patient?
The classic sign is that fluctuant lump, but sometimes if the abscess is deeper, you might not feel that.
Right.
The patient's definitely going to be in pain, though.
Makes sense.
All the classic signs of inflammation will be there.
Hmm.
Fever, feeling crummy, and they'll probably tell you they're having trouble breastfeeding.
Yeah.
Sometimes you'll even feel swollen lymph nodes in the armpit. Those will be tender, too.
So that's when we got to get some imaging to really see what's happening under the surface.
Exactly. Ultrasound is super helpful here. When it's just cellulitis, you'll usually see increased echogenicity in the tissue.
Okay.
But if there's pus, you'll see a hypoechoic collection on the ultrasound,
Right.
and you can often actually see debris moving around in there.
Oh, wow. That's cool.
It's wild.
So let's say we catch it early in that cellulitis phase before an abscess forms. What do we do?
Anti-staphylococcal antibiotics are key,
Right.
like cloxacillin, flucloxacillin, erythromycin. Those are all good options. And we really stress frequent breastfeeding.
Every couple of hours.
Yeah, ideally, and from both breasts.
Right.
Got to make sure they're emptying them well.
Makes sense.
Supportive stuff helps too. Good bra, cold compress, pain meds, all that good stuff.
Okay, now what if it's already an abscess? We see that collection on the ultrasound. What then?
Got to aspirate that pus under ultrasound guidance.
Yeah.
Helps confirm the diagnosis, and it's the first step in treatment. Always send that aspirate for culture and sensitivity too.
Of course. Got to know what we're dealing with.
Exactly. Now, when we're thinking about drainage, we usually prefer ultrasound-guided drainage over the old incision and drainage.
Why is that?
Well, the cosmetic results are usually better. It's easier for the patient to keep breastfeeding, and it usually works really well as a daycare procedure.
Nice.
Plus, you avoid the risk of a milk fistula. Those can be a real pain.
What about those really big abscesses? The ones that are just huge or have tons of pus?
Yeah, so if it's bigger than 3 centimeters or there's more than 30 milliliters of pus in there,
Right.
we might think about putting in a vacuum suction catheter under ultrasound guidance.
Oh, okay.
That way we can drain it more completely and keep it draining.
And then once we've drained it, what's the follow-up like?
Follow-up is super important. We usually see these patients every other day to check up on them, do another exam, and take another look with the ultrasound.
Yeah.
Make sure there aren't any pockets of pus left behind.
Right.
If there are, we aspirate those. We also adjust the antibiotics based on the culture results, and they usually need to be on them for about 14 days total.
Okay.
Oh, and if they have a catheter, we irrigate it with cold saline during those follow-up visits. Helps with the pain.
It's really important to understand how this all progresses, from the initial inflammation to how those abscesses form,
Yeah.
especially knowing all the ins and outs of those ultrasound-guided drainage techniques.
It can really make a difference
Yeah,
in how we take care of these patients.
for sure.
And, the advances in ultrasound technology have been a game changer.
Oh, absolutely.
The way we diagnose and manage these cases is so much better now. Patients are doing so much better. They're happier.
That's what it's all about.
It is.
Well, thanks for joining us for another deep dive.
Yeah, always a pleasure.
Thank you for listening to our podcast. See you in the next episode.